1.
Hey guys, we've been talking about tissue regenerative treatments. This is the TRT machine. As I said before, you know, the Cubs have one and the White Sox have one and we have one. We're just getting amazing results working on shoulders, feet. And this is a case today with Jenny where we had a Morton's Neuroma, and if you don't know what that is, it happens to a lot of people. You get like right between the tarsal bones, you get the nerve flares up, this cystic tumorish tissue. It's called a neuroma, and it hurts to walk. When Jenny came in last week, she couldn't even the socks took up too much space and created too much pressure for her feet. So she was limping in, and then when we took your shoe off and I touched I would just tap her foot and she'd go, oh, you know, it's 10. The pain's a 10 out of 10.
Definitely.
So I talked to her. You know, we haven't marketed this thing, but I talked to her about how the TRT works and how it targets damaged tissue or abnormal tissue and kind of opens up those cell membranes and stimulates healing and stem cells and blows out inflammation. And some of these treatments, like, you know, for diabetic neuropathy, so if you know somebody with diabetic neuropathy, send them in. But those treatments take a little longer, a lot longer actually, because the tissue is so damaged. But in certain situations, like with this Morton's Neuroma, you know, we worked on you maybe, 800 pulses or something like that, 10 minutes. And what was your pain like when you left?
I had none. I walked out of here without limping and it felt great.
So then here we are, a week later, very little pain maybe, because you go, depending on the case, but you know, with extremities, you'll go initial treatment, then maybe a week, then maybe at 2 weeks. And so it's not a lot of treatments. It's not like you're doing, 50 over 2 months. It's really a handful over a couple months. And so here we are a week later. And what was your pain like when you came in?
When I came in today, less than 1. It hurt, maybe like a little bruise, but that was it.
Yeah, and is it gone now?
Right now it's gone completely.
Yeah, we just did another treatment. So, you know, all clinicians do the best they can, and in the past, really, our only strategies, we do, standard ultrasound, scraping. I mean, we have a really comprehensive clinic, and we address things with this multi-therapeutic approach. And Morton's Neuroma is one that sometimes we get it better and maybe a little bit better, marginally better, and then a lot of times you mess with it and it comes back or we make it worse. Plantar fasciitis is another one of those that can be this is fantastic for plantar fasciitis. So, it actually, when you get calcium inside the tendons, there was a study, it was 2004 in Japan, they did a study with this where it was getting the calcium out of the tendons. So this technology is fantastic. It's new. I think I'm the only one in Indiana with one. So if you know anybody with a Morton's Neuroma or a shoulder problem or an elbow problem or a hip problem or diabetic neuropathy, which is like being in prison for people when they can't feel their feet when they're walking around, plantar fasciitis, you name it. It's just fantastic for all of those. So send people in, share this video if you know somebody suffering from one of those conditions, and we'll see you next time.